Hello and welcome. I'm Mark Hohenberg, a specialist geriatrician. I'll be your host for this Souvenaid case study mini podcast. Before we begin, I'd like to note that this case study has been fully anonymized to protect patient privacy. Consent was obtained to share the details for educational purposes. Whilst this is just one individual case, it offers valuable insights into the type of patient who may benefit from Souvenaid as part of non-pharmacological approaches to nutritionally support Alzheimer's disease alongside a pharmacological approach. Souvenaid is a food for special medical purposes and must be used under medical supervision. This podcast is for healthcare professionals only. In this episode, I'll walk you through how and when Souvenaid was introduced in the patient's care and share the outcomes we observed. So let's get started. Isabel is a 76-year-old retired office worker who was referred for a comprehensive geriatric assessment by her general practitioner in 2020 to assist with the complex and integrated management of her multiple medical issues. Isabel realized improvements with her medical conditions, but noticed some cognitive impairments after an acute COVID-19 infection in May 2022. These impairments slowly improved over time, but became more noticeable in late 2023. In early 2024, Isabel had testing that demonstrated evidence of Alzheimer's disease. This, coupled with evolving functional impairments in her day-to-day life, confirmed a diagnosis of early Alzheimer's dementia. With regards to her diagnosis, Isabel had structural neuroimaging, including an MRI of the brain that demonstrated cortical atrophy, as well as minor subcortical small vessel disease. An FDG PET scan of the brain confirmed significant hypometabolism in regions that correspond to areas affected by Alzheimer's disease. Blood tests and clinical examinations did not reveal any reversible causes of cognitive impairment. Isabel had functional impairments in 2 of the 6 neurocognitive domains identified in the DSM-5. Isabel had several cognitive tests over the years, including the MMSE, where she scored 30 out of 30 in 2020 and 2021, indicating no cognitive impairment. Then an MOCA, or Montreal Cognitive Assessment version 7.1, was undertaken in 2022, scoring 28 out of 30, and then 27 out of 30 in late 2023. Again, these scores would be classified as normal. In early 2024, Isabel scored 25 out of 30 on the Montreal Cognitive Assessment version 7.3, which indicated mild cognitive impairment, prompting our investigations that resulted in her diagnosis. The diagnosis of Alzheimer's disease was explained to Isabel with links to post-diagnostic programs considered especially important to understand the disease and how it is treated. Isabel valued this, especially the conversations on non-pharmacological approaches. At diagnosis, patients benefit from early management of cognitive impairments with non-pharmacological strategies, such as improving their nutrition, taking regular exercise, and ensuring they are socially connected. Early intervention with lifestyle changes has evidence of potentially slowing memory and cognitive decline. Delays to starting potential non-pharmacological management misses an opportunity to provide evidence-based benefits. At the time of diagnosis, Isabel was also offered Souvenaid as part of her non-pharmacological approaches to nutritionally support her Alzheimer's disease. Isabel was particularly interested in adjunctive non-drug approaches to manage her Alzheimer's and started on Souvenaid immediately through their discount and support program, Souvenaid Connections. The patient who has lactose intolerance has continued taking 1 bottle of Souvenaid liquid daily since early 2024 without any adverse effects, consistent with its suitability for individuals with lactose intolerance due to its low lactose content. As well as non-pharmacological treatments, Isabel was offered a cholinesterase inhibitor in accordance with evidence-based standards of care and was tolerant of Donepezil initially at the 5 mg and later 10 mg dosing. Isabel improved with her cognition both subjectively and objectively. She has been very successful at controlling her vascular risk factors and medical diseases which are recognized to worsen cognition, as well as implementing the evidence-based interventions that are recognized to improve outcomes in early Alzheimer's disease. Isabel's Montreal Cognitive Assessment scores have improved to 28 out of 30 on version 7.1 in August 2024 and 29 out of 30 on version 7.2 in February 2025, which now fall in the normal range again. She continues to demonstrate no objective evidence of frontal executive dysfunction, with improvements in memory, but continued mild impairment in language. Isabel reported feeling tremendous and bubbly after starting her Alzheimer's disease care plan, with no significant adverse effects except for occasional vivid dreams, which are attributable to the Donepezil at the higher dose. She found Souvenaid easy to drink and incorporate into her daily life. She sustained these feelings of subjective improvement and greater cognitive function through to mid-2025, when she was last seen in clinic. Souvenaid is an important adjunctive nutritional therapy with evidence supporting its use in early Alzheimer's disease, including mild cognitive impairment. For Isabel, the Souvenaid has been an important part of her journey, not just supporting her memory and cognitive function, but also in improving her outlook on life. Isabel plans to continue taking it for as long as it provides benefit to her. So let's summarize with some key takeaways to consider in your own practice. Early detection and diagnosis of Alzheimer's disease, including mild cognitive impairment, and the prompt management plan, including pharmacological and lifestyle factors such as Souvenaid, may be key to supporting a patient's memory and cognition. Souvenaid was well tolerated alongside the acetylcholinesterase inhibitor, and this aligns with evidence that has found Souvenaid to be safe and well tolerated when used alongside common Alzheimer's disease medications. Souvenaid was easy to incorporate into Isabel's day-to-day life and was well tolerated. Thank you for listening. This case highlights how Souvenaid can be integrated into a holistic management plan for early Alzheimer's disease, and I hope it provides useful insights to support your clinical practice.